Hello, welcome back to Once Upon a Surgery, the show where real patients share their personal stories behind their transformations. I'm the host, Kerry Berlet, with a world-renowned plastic surgeon, Dr. Anthony Berlet. And today, I would like to welcome our guest, Elaine. Thank you for coming, Elaine. Cheers. Interesting, Elaine has known Dr. Berlet for decades, and I'm really interested to hear about the different procedures through the years. Starting with, you said there was one in the 90s?
Yes, in the 90s, I had fat injections done in my smile lines.
Okay.
So
they were doing it back then, and Dr. Berlet was doing it back then?
Yes,
Wow.
Dr. Berlet. I was upset because they were really
Was there
deep.
not Juvederm then?
I went to go see Dr. Berlet because I worked with him at one of the hospitals in the St. Joseph healthcare system.
Okay, because you're a nurse, right?
Yes,
okay.
I am a nurse. And so I went to go see him because I was distraught because of these deep lines. So when I went to go see him, he suggested that I have fat injections. He didn't believe in the Juvederm, and he believed in the fat injections. They would last longer. So I did try for that.
Yeah, and he still prefers fat over those fillers.
Yes.
Yeah, there's a lot of bad fillers going on.
And it lasted quite a long time. So.
Oh, really?
Yes, I did not have to go for additional fat injections.
So was that the only thing? So you did the fat injection and then didn't see him again for years? Or you still work with him, maybe?
So I saw him again in 2008, and I went for a breast reduction.
Okay.
So I was unhappy with, after being a mom of two, and I was a lot larger than I wanted to be.
You look so thin now. It's like, I mean, I would never have imagined that you would need that. Yeah.
But I went for a consultation, and I wanted the breast reduction. I'm glad I got the reduction because I was very happy with it. My husband at the time wanted implants, but I did not, and it was
That's amazing. You were like before your time, because now I feel like that's kind of what's happening now. Yeah.
I needed to do what was comfortable for myself. I knew that I would not feel comfortable with the implants, and I knew what was right for my body.
Right. So you did, it was just like a lift, like a breast reduction.
With a lift.
With a lift,
Yes,
right? Yeah.
Yes, and I was extremely happy.
That's amazing. Had you lost weight, or it was just because of the kids, like the pregnancies?
It was because of the kids, and I did lose weight, and with the weight loss too. So it was a little bit of gravity helping.
Right, exactly. Yeah, as it happens with all of us.
Yes, yes.
And I mean, we'll get to, I'm just looking at you and I'm like, you look so young that it's crazy that you would have gone to him in the 90s. But we'll get to like the next procedure so you'll understand. But yes, but then in between that, then you said there was something with your daughter.
Yes, oh my gosh. My daughter in high school was playing field hockey, and I got an emergency call at work that she had an injury, and I get to the field, and she just has this gauze over her face, and she takes it down, and it looked like she had a cleft lip. The field hockey ball at a high speed hit her mouth, and it was just torn apart. So I took her to the hospital, and thank God Dr. Berlet was on call.
He was on call at that hospital.
At that hospital.
Because he doesn't do that anymore, so you're very
Well, this is, again, it was, for her, it was sometime between 2011, 2013, I believe.
Okay.
And he was on call. I got scolded a little bit because he knows I had his phone number,
Right.
and he wanted me to call him because the lighting in his office was much better.
Oh, right.
Because I had been going to him for
he already
for several
knew you.
things. He knew me, and but he did a beautiful job, and it was wonderful to see that her lip looked the same.
Wow.
So it was just, the treatment for her afterwards was just massaging her lip.
Wow.
She is...
and is there any scar now?
No scar. No,
Okay.
not at all. There's the Boston.
That was the
accent.
Boston. I heard the ska. I like it.
Yeah. Thank you.
But no, that's terrifying. And I mean, you see people, I know, like I've seen people who are bitten by dogs and then sewn up by a bad plastic surgeon, they have scars. So like when there is a lip injury, you have to have do it just right. So
oh my gosh. We were driving to the hospital, she wanted to look at her face, and it was like I was trying to prevent her from doing that. And when she saw, her face, the trauma and the fright.
Yeah.
So when she was repaired, she was able to smile again and be so thankful. So. Yeah.
How long was that? Like, could she not smile for a while?
She was, for a little while she was sore and there was some swelling for a bit, but it didn't take long for her to heal.
Okay.
Yeah, she
Wow.
did well.
Okay, that's scary. And now, is that the same daughter who is now engaged?
So, my youngest had that surgery done.
Okay.
Yeah, she's in Nashville right now.
Okay.
Yeah.
Right.
Yeah.
But no, and is that the one? So she's married now.
She's married.
Okay. All right. So then it's the other daughter who just recently got engaged.
Yes.
Okay. Got it. And so that's again. So this then would you say? So she got engaged when?
In December of last year.
Okay. And then what happened in February?
I decided I was unhappy with some of gravity just seems to travel and likes to follow me. So
it follows everybody, by the way.
I look tired. I look really tired, and her wedding is in October of this year.
Okay.
In 2025. So I decided to see Tony again.
Right.
I'm sorry, Dr. Berlet.
Yeah, that's okay. You've known him for 30 years. You could.
So I did see him again for a consult, and I had jowls and didn't like the jowls, and had some sagging in other areas, and I didn't realize I had ptosis of the eyes, and I needed eye surgery too. I also had my earlobes taken care of, and so I did have the deplane, and had a little piece of. He put something in just above my lip.
You did the smaz.
Is that it?
Yes, that's the thing he does now, in the lip, right? So it just gave you a little more volume.
Yes.
Yeah.
Just
So
a
he
little
takes
bit.
the little worm-like thing and sews it in, right?
Yes. Yes. He did that too. Wow. So I just had the upper
upper blepharoplasty.
Thank you.
Yes.
Yes.
Oh, I don't know how you'd say it in a Boston accent. That's probably why you can't, because you don't say ours.
It still will come out the same.
Right.
Yes. So, but that was done, and when I look at my before and after pictures, I'm like amazed because I don't look the same.
Really?
I'm just amazed. And when I went back to work, like my secretary says, I know you had your eyes done, but I didn't. But you look refreshed. Like you look really refreshed, and my friends say I look at least 10 years younger than my stated age. So
what's your stated age?
I'll be 65 in 4 months.
Whoa!
Yeah.
Oh my God! I mean, and I didn't know you before, but you look so young.
And that's what I wanted. Thank you.
Right.
That's what I wanted to present. Because I don't feel my age. I'm very active, and my mind does not act, my age. So
Right. Well, it's funny. And it's like the perception of what a certain age should act. But that's what I think is that you feel, you still feel young on the inside.
Correct.
And then, but then you look in the mirror and like, there's like, this old face people see, right? Or like whatever it is. And like, you're like, this isn't how I feel. Like, I feel better than this. But then when you look at that, then it's almost like this cycle of like, then you start to, oh, I should like, it becomes part of like mental, Right?
It does. And you wake up in the morning, and when you have this older, drawn looking face, you just say, but this isn't me. I act, younger. I feel like I'm in my 40s, and I just want to look like I'm in my 50s. I'm happy with that. And the results that I received, I think I do. I think I look like in my 50s. So
yeah,
I'm really happy. So
yeah, and it's like nothing, like you did all the, it's all looks so natural, and like I love what he does with the lips now, because it's like so many bad lips, but like not that he does, but just that I see from other procedures people do, and it's just, it looks, you would never think that you had done anything.
Yeah, because you look natural,
Yeah.
And you don't, like, my face isn't super taut, and my lips look natural. They're, not inflated, and my eyes they're open, and, they're not, like, pulled back, and they're just, he does an amazing job. And he just I feel beautiful again.
Right. But it's funny because I made the connection of like your daughter getting engaged, and then maybe it wasn't conscious, but he says like this is a thing that it's like, because people talk about procedures people do before their weddings, and he's like, well, it's not, if it's an older bride, that's one thing, but it's the mothers.
Yeah. Maybe it was, that facelift maybe in the back of my mind, wanting to do that, before her wedding, and perhaps.
Yeah.
Perhaps.
And then, so how long, so you did 3 procedures at once, so you said also the ears, that's always part of it too.
They're so like tiny now, and though he never wore.
Oh, does he need to re-pierce them now?
I know, I was
okay.
I have no piercings.
Right, no, so he has to, they weren't pierced before.
They were.
Oh, they were, okay.
They were, and I'm like, how am I going to wear like the earrings for the wedding now? I need to
he'll pierce them.
Really?
Because so he did, yes. So that's what he does, because he shortens the ear, and now you have to go back, and he pierces ears.
Okay.
Yeah, so now you go back and he'll pierce your ears.
Okay. That's good to know. I didn't know that.
No, that's part of it. All right, so good you came. Because you would have just thought, now I don't have, like, no, he himself, and he will do the best job and make sure they're even.
Oh, I know he will. Yes. I trust him.
Right,
so.
right. And like, so before you went, did you know anyone who, you worked, so I'm sure are there other nurses who have had facelifts with him, or did you have other friends, or?
I didn't ask.
Oh, okay.
I just knew that, I trusted him with my reduction and with what he did for my daughter. So, why would I go to anyone else?
Right. Yeah.
And so people have seen the work that was done, and there was someone that I did go to for Botox, and she's been giving his number out to everyone, and has referred some of her clients to Dr. Berlet. So.
Right. No, it is. And did you say it was both did you do lower, or you didn't need lower?
I didn't need lower.
Yeah, because your lowers, just naturally must be good. Yeah. And so then, but the uppers, they look like you have like really bright, like your eyes, look very youthful.
Yes, and you know what? My peripheral vision also improved. So
really,
that was an extra bonus.
Wow,
I know.
Because maybe he opened them up more. Well, because that's the thing, is because as you age, you get that hooding, and then people can't open their eyes the whole way.
Exactly.
Yeah.
Oh. So it's like I'm safe on the road again.
Right. Wait, and how long were you out of work when this? Because I know the eyes are bruised. Like that's the main thing.
The eyes
right?
are bruised, and I was out for a few weeks.
Okay.
I took some time.
Okay.
And so I was okay.
Like, and how long before you felt like Because like you took time off work, but then how long before you felt you could go out in public?
I decided to take at least 4 weeks off.
Oh, wow.
So
okay.
I was able to. I had the time to do so. I have to just to advise everyone that take the time and follow instructions. You know, sit up if you need to sit up and prop yourself up and sleep upright for 2 weeks. Sleep upright. Take the vitamins that are prescribed, and the arnica. I asked to take vitamin K. I was allowed to take vitamin K, and that all helped. And satin pillows.
Really?
Yes, satin pillows.
Oh, interesting.
Yes.
Why does it as you're healing? What is it about why?
Well, when I first started to sleep on regular pillows, I end up pulling one of my sutures.
Oh.
So the pillow was a little rough, but even though they were soft. So for a while there, we were watching one of my eyes just to see if I needed to do a revision. So I opted, I was doing, reading some things, and I opted to go for the satin. I should have went with the satin pillows from the get-go.
Oh, that's good to know.
Yeah, so that way I was sliding.
Well, I've heard it's good for your hair too.
Yes.
But yeah, you have it and then you're like sliding all around.
Yes. And you know what? Just be patient too with the eyes, because it takes time for your eyes to heal. And though you might think the symmetry is off for a little bit, but
no, that looks perfect.
Nature takes you need to let nature take its course. Time takes time, and it works out, and your eyes will work out and they'll look beautiful.
And did he have you doing the exercises where you like squeeze?
No, I didn't have to do any exercises.
Okay.
No, I just had to be patient. I just had to be patient because I'm very, as a nurse, you're looking at the healing, and like at one point, why is one eye like opened a little bit more and the other eye isn't, and it was, each eye healed at a different time. So it was, I had to trust the process.
Right. Okay.
Yeah.
How did your daughters feel about you getting a facelift, or did they know?
So I told them I was going to do it, and at first their reaction was hesitant, but they supported, what I wanted to do, and if it made me feel better, they were all for it. When I decided to go back for some fat injections.
Oh, I was going to ask if you had done that too, and that's amazing too, right?
So I had lost some weight, and I had some deep pivots into in my temple area. So I wanted to get some fat injections just to supplement because of the weight loss I had. During, after the procedure, I had lost like 20 pounds.
Oh my gosh.
So it was something I had wanted to do. So I had some fat injections done, and my youngest was upset.
Oh, really?
She was upset. She didn't want me to do any more plastic surgery, but I tried to explain to her, and when she came for a visit, she understood that I needed to have this done to fill out my face a little bit. And then when she saw me in person after the face, had injections, she realized it was natural looking.
Right.
You wouldn't even know right now that I had fat injections.
No, and I can tell, you have a similar, I've had it too, you just have that type of face where it helps, that extra volume, and it is very natural. You don't look like a chipmunk, and
Right, it's not there's no fullness that just
Yeah, what
Like-
makes you look fake. And I know
Right.
everyone's afraid of like, oh, the bad plastic surgery, you know.
Right.
But
No,
yeah.
not at all. It's,
Right, and it's not like, oh, you're insane, now you're getting another thing. Like, this is all adding to like a very, like, just helping you look youthful and
Right.
you know, and it's again very natural.
It
you
is
know,
natural.
natural looking. Yes.
Right.
Yeah.
So, and again, I put my trust in Dr. Berlet.
Yeah.
So, when I looked, you know, in the beginning, you look at the injection, and he said, right now, you know, it's going to 35%. It will, you know, will recede.
Yeah.
But then it will naturally come. You'll increase your volume of fat eventually. So it looks natural, and I'm happy.
No, and I feel like since I've done it too, like it's just somehow it rejuvenates something, and really like
Yes.
the appearance of your skin. I feel like it helps, like it gives an extra little glow or something.
Yes,
Yeah.
it does.
Yeah.
And that's what everyone says. You know, my skin looks really smooth. You know, no wrinkles.
Yeah.
So,
At 65, I mean, that's amazing.
so it's very
And
happy.
I mean, do you look at pictures now? So, like, do you look like you looked in your 50s now, or do you look better than you looked in your 50s? You think?
I think I look better.
Right? It's
I
like
do
a
think-
younger but better version.
Yes.
Yeah, it's funny because when I look at some of, just when I was younger, you're like, wow, it's like somehow it's almost like you can look better when you're older if you do it right.
I look at some pictures even when I was in my 40s, and I look now, and I'm like, there is that glow, you know, and the light that you even have in your eyes, and you know, and the sparkle, you know, the glistening. It's, you know, it's just because you're happy,
Right.
You know?
Yeah.
Yeah.
Well, I mean, I feel like you look amazing, and I like you're gonna look great in those wedding photos. And like, I mean, it's like I would never have thought. Like, I mean, you just look like you would. You're naturally thin. I don't know. I mean, not like 20 pounds is that much, but like I feel like you're like your optimal self, like ready to, you know, be like, you know. Hopefully you don't take away from your daughter. Right?
No.
You don't want to overshadow or upstage the bride.
Thank you.
But yeah, I mean, and so, I mean, so I'm very thrilled that you kept Dr. Berlet, you know, in mind, and I'm so happy to have met you. And I hope you can inspire other people who might be considering, you know, having a facelift, that you can do all of these things, and it's not that you look plastic. Like, it's really, he likes to say it's like almost just like, it's like you were tailored, right?
You know, if people go on Dr. Berlet's website, you'll see the before and after photos. So you'll definitely see the difference.
All right, so we have brought Dr. Berlet in to dive a little deeper into some of Elaine's procedures. And so I'm interested to hear from you, because I didn't even know that fat grafting existed in the 90s. And she said she came to you in the 90s, and rather than filler, even then you did fat grafting, which that still is a preference of yours, right?
Yes. Fat grafting is obviously superior. The techniques, though, have been refined so much that it really has become a beautiful, elegant procedure where you can actually put the fat into the eyelids and around the eye with the issues of clumpiness or
So what's changed? Like, is it the needles, or what you do with the fat, or both?
what we do with the fat is pretty simple. You just basically get the oils off and break it down to make it more of a pure form. But now we can actually change the size of the fat cells that we're putting in, or the clumps. So you can break it down. There's something that you put between the syringes, and you go back and forth, and it can emulsify the fat to the point where it's just stem cells and exosomes, or you can get it to like very small cells that are together versus bigger clumps. So it has
Interesting.
advantages. So it's much more refined in that way, and it's much more exact. And you can get it so fine that you can literally put it into the eyelids, things, beautifully into the temples. The fat was a little bit bigger before. The cannulas were much bigger, much
Okay.
bigger. Like we're really using,
Right.
you used like a 16 gauge needle to put them in the past, which was a special needle. It would come out the side versus the tip. because what the thing with fat is, or any injectables, you're worried about something called emboli, where the fat can go into a vessel and then go to the end point and actually kill whatever tissue that vessel would be feeding. So that's a serious complication, but it's rare.
Okay.
And now it's very rare.
Yeah. And what's interesting, because she said you put it in her smile lines.
Yeah.
And so
That was back in the day.
Okay, because I was going to say, you've done fat grafting on me, and you've done it in my cheeks, like, temple, whatever, but never smile lines.
Right.
So what's changed with that?
Well, I'm not a big fan of chasing nasolabial folds.
Uh-huh.
I do like the marionette lines. I think they're a great place to put it.
Okay.
This can tend to get almost artificial.
Okay.
Because you're supposed to have some differentiation between your lip and the cheek. And usually most of the problems that you have with the cheek isn't so much the crease here, but the roll that's created by the loss of volume.
Okay.
Here.
Right.
So if you fill this volume, it blends it better.
Okay.
It might have been the marionette lines then that
Yeah,
you
but-
did.
Well, I may have done the nasolabials back then too.
Yeah.
Because everything else. is
You're learning and evolving, as things go.
I forgot that we did that.
Yeah.
You've known her for 30 years.
Yeah.
That's
I have.
crazy.
Actually, maybe more.
That's amazing. I mean, she looks I can't believe, she looks so young. I would never think that she would have done, something in the 90s, that's crazy.
Well, maintenance.
Yes, it's
important
all
back
about
then.
good maintenance,
It was
right?
important
Yes.
back then too.
Yeah.
It's all good.
And then, and do you remember when her daughter came in and you were on call and you fixed her daughter's? She had gotten in a softball accident, right? Softball,
Field
hockey.
hockey.
Field hockey.
It looked like she
Yeah.
had a cleft lip.
Yes.
I brought her
Did
to
you even
St.
remember that
Joe's.
you did this?
No.
That's okay.
I don't.
You did a wonderful job. She looked like she had a cleft lip, and you
I did a lot
scolded
of those
me.
in the day too.
Yeah, you scolded.
Yeah, you actually, that was something that you specialized in, was
used to
cleft
do-
lips.
I
Yeah.
did a lot of them.
Yeah. And so she was so lucky that you were on call. Because I was like,
Was that how you found me, or was it through?
because she was mad. She said that you were mad because you had better lighting in your office.
Oh yeah, I wish you had called.
Yeah, and you wish that she had called you because at the emergency room you can't see as well or whatever,
Well,
right?
the instruments aren't nearly as good either.
Okay, but so is that advice? It's if you know a plastic surgeon and you know it's just stitches, right? You might if you're able to pull them off the golf course or whatever's happening.
Try to be there for my friends and my patients.
Yes.
Always there for them.
Yeah.
I can be.
Right. Well, we hope
As long
that
as I'm
people
in
don't.
town.
What's that?
As long as I'm in town.
Yeah, as long as you're in town. Yeah, and and she is it's the classic mother of the bride facelift. Her daughter was engaged in December, and then you saw her in February for this work, and then and as far as what you did, the facelift, do you want to talk about the procedures? So she's had facelift and the eyes, lip lift. Or no, did you do a lip lift?
No.
No
We did-
lip lift,
we
but
did put
but
some
you did the
smaz.
smaz. Yeah, that's what she was saying. Yeah, the
Yeah.
smaz. And then ear reduction, which by the way, she didn't know that she could pierce her ears again.
I don't know how that's.
But wait, can we see your ear? Look how your ears look so nice.
Yeah.
Wow,
They were
yeah.
hanging low.
Well, that's what you say, right? Is that
I
people
think you have to address it. It's one
Yes.
of those things that is.
they
often
look like
not addressed.
children, ears, really that's a youthful looking ear.
That also makes your
Yes.
neck look longer. Reduce some of those lobes.
Yeah.
The old saying,
Right.
"Do your ears hang low?"
Right.
To and fro.
Right.
Can you tie them in a knot? Can you tie them in a bow?
Right. Yes.
All right.
Wait, and you were talk about her eyes.
So that was actually my biggest concern with you. Because when you came in, you were kind of half-masked. You looked very, you look like you're stoned, just to use the expression. And you're not. But you're, what happens sometimes is the muscle that lifts the eye gets attenuated. So you literally can't open your eyes all the way. So you look tired all the time.
If I look at her, she has bright eyes now.
Yeah, we fixed it. That's the whole point. So that's a ptosis repair. So
Okay.
she had severe ptosis of both lids. She had, the bags. She had some significant volume loss in her face.
But so she had the bags, but you didn't do a lower bleph, you said?
No.
No. We
You
filled it
could
with
just,
volume.
right, so you could just
So-
address that with fat?
So, but her ptosis, her upper lids were significantly an issue. So, but you were able to blend the loss of volume in the cheek with this, but she didn't have a lot of fat around the eyes, so that was good. So you can blend it enough that you don't really need to do a lower bleph.
So, because how do you know? So she had bags. So what's the differentiator between someone who needs a lower blepharoplasty and who doesn't? That you're able to just do like fill in with volume.
Well, if they have a lot of, if the bags are large in terms of like they're fat pads that create the bags.
Okay.
So if those fat pads are large, you can't camouflage them.
Okay.
Right? You don't have many bags on your lower lid.
Right. But so
you're able to
can
do
you
with as well.
can you tell that before, like, so you can tell from looking at someone whether they need the lower bleph or not, like by their fat pad things?
It's not subtle.
Okay.
No, they're usually pretty bad.
Okay.
The lower back, lower lids are a little more difficult.
Right.
than
Okay.
Upper
Right.
lids, a lot more difficult. Although if
Yeah.
you're doing a ptosis repair, that's a little more involved.
Right.
Instead, you have to dissect out the muscle and
Yeah.
really break down the anatomy and then put it all together.
Okay. And so she is 65. So that to me sounds like that's actually on the older side for when people usually get their first facelift. Having known you for 30 years, I'm just saying.
Well,
Right? Or what's the
typically-
typical age?
Typically, facelifts start in the later 40s.
Okay.
And that's because everybody ages differently.
Right.
But usually around 50, you start losing ligamentous support. Like before that, you can kind of fake it with, a lot of people use fillers because that's their only tool.
Right.
I like that. But you can sort of put things, just fill out the volume. Because loss of volume is what really occurs from like basically 35 to 50. But then after 50, all of a sudden you look in the mirror and you go, what happened? I got jowls. They weren't there before. And so the jowls, and they keep getting worse, and the neck starts hanging a little bit more. So so that's around 50. So that seems to be the turning point. And then most people, that the seed is planted then. So 55 seems they pull the trigger.
Right.
And some people a little bit later. It's all good. The range is literally late 40s to late 70s.
Okay. Interesting.
That's it. Usually late 70s is a redo, but
Right. Yes. And is there any, so, because like, had she, like, doing one for the first time at 65, like, would you say, like, because sometimes you say you like, it's actually better when it's a second facelift, right? But like, is there any difference, like, in terms of, I mean, she looks so young, but had she done one earlier, would she be needing another one now? Like, or?
there's various schools of thought. I mean, obviously, when you're younger, your skin has a little more elasticity to it, so you can get away with a little bit more. And it's much harder to make a 70-year-old look like they're 50 than it is to make a 50-year-old look like they're 30.
Oh, really?
Yeah. So.
Huh.
Well, it's just that the skin's not the same.
Interesting.
But we're I don't know, attacking age or whatever you want to call it, but we address the volume loss, which is really important. We're repositioning everything. So you'll hear about. I mean, there are really almost 11 facelift types that are described. Some people say, I want the deep plane, I want this, I want that. But,
Yeah.
So,
and was hers a deep plane?
it is a form of a deep plane for the face. But I do not do a deep plane neck lift. I don't feel comfortable taking out the glands of the neck.
Okay.
Too high risk, very high percentage of nerve injury, very high percentage of something called the cyaloma. If you're taking out salivary glands, you can literally collect saliva in your neck, which can take months to resolve. So
Okay.
I don't know if it's worth it. We're all trying to be happy here.
Right.
I don't know. Perfection doesn't really exist, but it can be. But you can get dramatic improvement. Really.
What did you do for my neck?
Well, we took the fat out, and we reset the platysma. We reset it. So we reset it back this way, so it really accentuates the jawline. We literally take out about that much tissue. So it's something called the smaz, which is the deep tissue.
That's what went in your lip.
And then we take a strip of that and we thread it into the lips. Just because it's a perfect delivery system. It's basically fat connected by fibrous tissue, and you can thread it in the lip, and it just sits perfectly, so you don't get that sort of a lump here and a lump there. Yeah, really nice. And it's a good take, usually pretty decent take. Gives a good volume.
Amazing.
You know, you have the trauma with the initial tissue, but once that settles down, everything sort of falls in perfect place.
Okay. And so she said you also did the fat grafting, right, after the facelift. So is that typical? Like, is it every patient who gets the fat grafting or just specific ones?
Well, in reality, every patient needs fat grafting. Not every patient gets it because they just don't do it. I personally prefer to stage it if I have an opportunity. Some people can't wait, but I would prefer to stage it only because I feel like I can get into places that I normally wouldn't get into. Like if I'm lifting up all these flaps, it limits me from putting fat through here. You can put it very deep, but I prefer to put it where you need it. So this allows me to put it in many planes versus just one. So I prefer that.
Okay. Interesting.
It's like putting spackle on if you put up the wallboard.
All right.
Put the wallboard up, then you do the spackle.
Okay. Excellent. All right.
It's all good.
Well,
Yeah.
I think you did great work. I'm shocked to hear she's 65. I'm like, it's just amazing.
She's come a long way. I could tell you the whole the eyes was a terrific result, but the fat took it to the next level. What'd you say?
It did.
Takes it to the next level.
And how long ago was the
very
fat?
hollow temples. Very hollow.
How long ago was the fat?
I want to say, was it 8 weeks ago?
8 weeks ago.
Okay.
Maybe.
Yeah.
Yeah, I mean, and
But
just
what happens is, I mean, she was very strong rims. Like she was rimming here. She's very hollow in her temples. You know, you have a little bit of hollowing of your lower lids just as age goes on. So when you can fill all that whole zone through here, it is very rejuvenating.
Okay.
And you can put it around the mouth, and you can put it into more into the lips. You can put it into, you can break it down to the nano fat and actually put it into each of the individual cracks around the mouth, and that delivers the stem cells and the exosomes. And you can really, it's magic. You know, the fat is like magic. You do the face, you go, wow, you look 15 years younger. And then you do the fat, wow, you look 10 more years younger.
It true, just though, continues.
Right? It's really impressive.
Yes. Right.
Yeah.
It's just another component of aging. You really have to address that volume.
Okay.
Super important.
Right. And so now, as a future mothers of brides, right? If when their daughter gets engaged, like how much time do they have? Like when should they be doing this stuff if they want to look good for the wedding?
Wow.
How much they're like basically, yeah. What's the ideal timing prior to the wedding that you're done?
Ideally 3 months if you have a child that's going to be married. At least 3 months.
No, at least
6 months.
Ideally, you have at least 3 months before the wedding.
That's your kind of cutoff, I think.
Okay.
If you have a major event like that. I mean,
Right.
you could be presentable. You'd say you probably look pretty great in 5 or 6 weeks, right?
Well,
But the fat just took it to another level, though.
Yeah.
That
Yeah.
really took it to another level.
Well, and if
That gives you a chance to evaluate that. And
Right.
say, it would really help you.
Right. And so typically, because she did the fat if it was 8 weeks ago and the facelift was in February, so that was like 2 months after that you did the fat grafting somewhere like that?
Well, I'm at 5 months right now.
Oh, you're at 5 months. Okay. So it's 3 months
It's
after.
about 3 months.
Okay.
after.
Okay.
Yeah.
Okay.
Now, it's just such an amazing, combination. And if you allow me to stage it, boy, we can tweak things till you're blue in the face. Hopefully you're not blue in the face.
No.
But hey, that's all great.
Well, you're blue when you do the initial tweaking, and then the
Yeah, a
blue
little
goes
bruising.
away.
A little bruising.
A little bit, not a lot.
Not terrible
Yeah.
though, right?
Yeah. Awesome.
I
Well,
mean, I remember you coming in 2 weeks after your fat grafting, like, holy cow. It was a home run. You just knew it right away.
Yeah,
You knew It
definitely.
was just a home run. But it took
Awesome.
it to a new level.
yeah.
It did.
And this whole thing is all clean, beautiful jawline. Perioral is so important, right? The mouth,
Yeah.
bringing it back. Yeah, it's all good. Yeah, sometimes we'll do a lip lift. I think she has a little bit of tooth shell. We didn't want to push that.
Right.
So if you
Okay.
have tooth shell, I'm like, all right, I don't want to make it too gummy or anything.
Right. Okay.
But she was perfect.
Well, it's nice that like you don't have a one size fits all. Like you do, like she did. Like you're not like, okay, let me add this and add this and add this. Like so, you didn't force a lip lift on her. Like it's just you evaluate each person individually.
Yeah, you have to customize. That's what it's all about. But like I said,
And I think
For
that's
her,
why
I
your
mean,
people look so natural, because you're not doing every procedure on every, like everyone is getting like a different,
For sure.
you're optimizing each person for their like individual
Well, you're dealing
needs.
with a lot of things. You deal with budgets, you're dealing with this, you're dealing with that.
Right, yes.
Trying to make it all work and give you the best bang for your buck.
Perfect. So I hope that you enjoyed this episode of Once Upon a Surgery. I found it very informative to learn about the facelift, how fat grafting's evolved, and interesting that you could have a patient for over 30 years and she can still look totally natural, not plastic at all, and ready for her daughter's wedding. And we right now, we have 2 people that aren't drinking, and so we're using non-alcoholic champagne, this toast, that's actually a sparkling white tea with cranberry and ginger. And I just want to say cheers to Dr. Berlet, and cheers to Elaine, and cheers to your upcoming, event with your daughter's wedding. Very exciting. You look amazing.
Thank you.
Terrific.
Cheers.
Cheers.